yeah, take comfort in the fact that as long as you're not doing those activities we mentioned in the beginning that are like generally off limits, like the extreme sports, risk of falling, that kind of stuff, your baby is safe. Welcome to the Vibrantly You podcast. We're your hosts, Megan Martineau.
Caitlin Cipriano. In this podcast, we talk about fitness and nutrition on your motherhood journey. Whether you're trying to conceive, pregnant, postpartum, or beyond, you're welcome here.
Nothing is off limits, and our goal is to support you in this important season of life so that you can feel vibrantly you. As a reminder, this information is not medical advice. Please see the show notes for more details.
Welcome back to the Vibrantly You podcast. Today, we're going to be talking about pregnancy-safe exercises. This is a term that gets thrown around quite a bit on social media, and even if you Google pregnancy-safe exercises, you get a lot of conflicting information. So, Meg, let's talk about why someone might be searching for pregnancy-safe exercises and what that even really means.
Yes. So I find that people are just really nervous to exercise during pregnancy in general. And I think this likely stems from old advice just about not overexerting yourself in pregnancy and resting, which is totally understandable to not want to overdo things, being nervous that you're going to do something that could hurt your baby or compromise the pregnancy. But as long as you've been cleared to work out by your doctor, like, exercising in pregnancy is safe, it's recommended. But I think things that make people nervous are, I know we've talked about first trimester stuff before, but obviously, you're not feeling so great, you're nauseous, everything's new, you might be worried about risk of miscarriage. So, totally makes sense to be nervous during the first trimester, wondering what you should be doing to adjust. In the second trimester, that's when your belly is starting to grow. Things maybe feel a little different. And you're like, I don't know, like this felt okay for me during the first trimester, but is it okay for me to continue doing it right now? And then, of course, in the third trimester, typically your belly is huge by this point. So, like some things you might not be able to physically do. You might be wondering, are you going to hurt the baby? Are you going to put yourself into preterm labor? So, like, it totally makes sense to have fears, and the fears change as you move through each stage of pregnancy. So it makes sense, but we don't need to be afraid.
Yeah, I think that's so common. Even I remembered during my pregnancies, it's like my body's not like moving how it typically would move through things. Like, how do I make adjustments? I found that to be challenging.
Yeah.
And also thinking about like, what are some activities like should I be avoiding? Are there things that we really should maybe not be doing in pregnancy with workouts?
Yeah. So, like I said, first things first, you always want to make sure that you're cleared by your doctor to exercise in pregnancy. Like, that needs to be the first thing that you're doing. Are conditions in pregnancy where exercise is contraindicated or not safe? So, this could be things like being on bed rest for whatever reason or having some sort of high risk complication. Again, this depends on the individual. So, check with your doctor. According to ACOG, which is the American College of Obstetricians and Gynecologists, there are certain activities that should be avoided no matter who you are. So that's going to be contact sports, anything that's going to put you at risk for receiving a direct blow to the abdomen. So you can think about any sport where you could collide with somebody else or an object, or you're going to fall, anything that's a direct blow to your abdomen. Skydiving, I feel like that's common sense. Anything that can result in a fall. So this could be an activity like downhill skiing, gymnastics, surfing, anything that's more categorized as like extreme sports. Any heated classes like hot yoga. And this is because of the temperature increase and just the risk of you as the individual getting overheated, lightheaded, dehydrated, things like that. Because if you're, lightheaded, dizzy, you could fall over. So that's something to keep in mind. I know that that's a question I get a lot from people is if they can do hot yoga generally. Try to avoid that. Scuba diving, obviously you could run out of oxygen. And there's like the whole depth thing. And then any activities performed above 6,000 feet in elevation. Basically, these are things that like I feel like the vast majority of people are not doing. If you are someone that regularly performs one of these things, Even like horseback riding sometimes can fall into that like category of anything that can result in a fall. But if you are someone that you have been riding horses since you were 6 years old, you know your horse, like you feel confident on a horse, have a conversation with your doctor, see what they say. It really is individual. But for like the vast majority of people, these are the things you're going to want to avoid.
Yeah, I know when I was pregnant with my son, I was still covering sports. And once I can't remember when the cutoff was, but they didn't want me to cover ice hockey because they didn't want
Oh,
to like
wow.
have me potentially get like I was on the bench, like the team bench, and so they were
Yeah.
like, we don't want you to get hit with like a puck or a stick, or if you do have to go out on the ice, like we don't want you to fall or be have to be in like a position where you're assisting someone that's really hurt. So I had to find someone to cover ice hockey for me. I must have been like my third trimester or something. But
Yeah.
yeah,
That's interesting. Makes sense though. Because,
yeah.
yeah, that would be bad.
And so when it comes to like, those are obviously, I feel like more activity based for like lifestyle. What about when it comes to regular workouts or like exercise classes? Are there specific things that people need to stay away from?
Yes. So first, let's talk about like warning signs where you should definitely stop exercising. So if you are doing a workout and you experience any of the following things, that means you need to stop and call your doctor. So that's going to be bleeding from the vagina, feeling dizzy or faint, shortness of breath before starting exercise, chest pain, headache, muscle weakness, calf pain or swelling, regular painful contractions of your uterus, or fluid gushing or leaking from the vagina. That comes directly from ACOG. With the headache, I mean, if you're experiencing a migraine, yeah, probably don't go do a workout. Have that be your rest day. If it's like a normal headache, like, you know, you can you can use your own judgment there, but I think the reason headache is on that list is because typically a headache can be associated with preeclampsia. So it's just something to be mindful of your blood pressure and everything. But for most people who are having a textbook pregnancy and have been cleared to work out by a doctor, if you are working out, most likely you're not going to experience any of those things. So I don't want you to be nervous and be like, oh my gosh, if I work out, like one of these things is going to happen. Most likely not. But it is just something that you should be aware of. If those things happen when you're exercising, that is not normal. And you should at least check in with your doctor to see what they want you to do.
Yeah, that all makes sense. But still, I think, again, helpful for people to know that, okay, if I am exercising, these are things I should be aware of and look out for.
hmm Yeah. And so then when it comes to specific exercises or things to avoid if you're in a workout class or whatever, really the only thing that I recommend paying attention to is your core. So if you start to notice coning or doming, which is like a ridge down the center of your belly, so it's going to look like yeah, I mean, yeah, like a ridge or like a triangle coming up on your belly or like bread loaf like popping out. That's a sign that your core is not strong enough to handle the demand that you're placing on it and that your deep core, your transverse abdominis, is not engaging correctly. And I know we did a whole episode on ab exercises in pregnancy. So if you haven't already, make sure to check that out. It's episode 7. I would say in the third trimester, many people can't tolerate a full plank, and you really shouldn't be doing crunches or sit ups. So that's kind of like what I recommend in terms of exercises to kind of not necessarily stay away from, but I guess just be mindful of. Other than that, when it comes to exercises that are quote unquote safe, it really does depend on the person. And I think this is why the term pregnancy safe exercise can be a little tricky because what is safe for one person might not be safe for somebody else.
Yeah, I think it does obviously depend on like what is your baseline level of fitness going into pregnancy and what are your experiences like. And so obviously this is why one-on-one coaching is so helpful. But are there things that you can share so that someone might be able to know, okay, is what I'm doing right now like safe for me?
Yeah, so definitely checking for coning, like I mentioned. If you notice that, say you're doing, say you're doing like a bird dog, which is generally safe for pregnancy. If you look down and you notice that you're seeing that coning down the center of your belly when you're extending both your arm and leg, opposite arm, opposite leg, that might mean that you're not engaging your core correctly. So you could kind of like reset, try to make sure that you're really able to engage that transverse abdominis. If you are fully engaging to your best ability and you're still noticing that coning, then maybe it means that you just need to regress that exercise a little bit. So rather than extending both arm and leg, you just extend your arm, and see if that resolves the coning. It's totally normal and expected for us to have to regress workouts as we move through pregnancy. So just being mindful of those signs. Again, it's not that like coning is dangerous, it's just your body telling you, hey, this isn't working for me right now. We need to make an adjustment. If you notice an increase in like aches or something is causing more like muscle pain or discomfort than it usually does, or you're having an increase in like pelvic pain, or maybe you notice like you're having more leaking, like peeing yourself, then maybe the exercises you're doing are not right for you at that point in time. I will say it's kind of hard to give like a blanket statement. And like you said, that's why one on one training can be really helpful. But that's also why people sometimes feel like a lot of generic prenatal workout programs feel too easy. And it's because those generic programs are designed to work for most people. But because pregnancy is so personal, it's so individualized, to have the best workout program, you do have to take into account like energy levels, sleep, nutrition, hydration, your pre pregnancy fitness level, what your baseline strength is, prior injuries, prior pregnancies and births, what your birth preferences are, what your goals are. So, like, there's just so many variables. If you're experiencing SPD, pelvic pain, SI joint pain, sciatica, like, there's just so many things that an individual can be experiencing during pregnancy and that they can be coming into that pregnancy with, which can impact your overall enjoyment of exercise in pregnancy, but also the effectiveness of a workout program.
Yeah, absolutely. And, each pregnancy with exercise can be different. I think
Hmm.
I can relate to you too, as like my first pregnancy with my son, I really didn't know like exactly how to make those adjustments for myself. And so exercise really wasn't very enjoyable because I was like, I don't know, like, should I be doing this? But then I worked with you in my second pregnancy, and I did have a lot of like SI joint pain and really needed that to support to be able to know like how can I help myself feel better and have like a better pregnancy and birth like, outcome as well with my body. And so
Yeah.
it's so like again so helpful to have someone with that really specific knowledge to be supportive. And so what would your advice be for people that they do want to work out during pregnancy but they are nervous about how to do it safely?
Yeah, and I think just to comment on what you said about like with that SI joint pain, it made exercise so not enjoyable for you. And I do feel like that happens for a lot of people. Like they want to work out, but then they try to do something and they're like, this is terrible. This makes me feel worse. Why would I do that? And that is the thing. Like it's so individual and you can exercise and it can feel good, just the adjustments that you need to make are going to vary, on an individual level. But in terms of my advice, I would say if you're able to, invest in a prenatal personal trainer working one on one. And I'm not just saying that because that's what I do, but it will teach you so much about your body, especially your pregnant body, all the changes that are happening in your pregnancy. And it's going to serve you into postpartum and beyond because a lot of the principles and the tools and techniques that we work on in pregnancy are also things that you need in that postpartum recovery as well. And again, like I said, beyond. So, because once you're postpartum, you're always postpartum. So, It can just be like a really valuable learning experience too. And you can learn a lot about your body, how it moves, what it needs, how to make adjustments for yourself. But if that is not in your budget, I would try to get in a few appointments with a pelvic floor physical therapist or occupational therapist. You can learn so much about the changes in your pregnant body, like I mentioned, and like how to accommodate in just a few sessions with a really high quality pelvic PT. And sometimes those are people who do not take insurance. And I know like that can obviously be a bummer if you want to use your insurance, but like I just personally find in my own experience working with a PT, in my clients' experiences, in talking with a lot of pelvic PTs, the quality tends to be better if you do find a PT who does self pay and doesn't go through insurance. And with these PTs, you need less sessions typically. Like they can accomplish a lot with you in like 2 to 3 sessions. So that's something that I would maybe try to look into. But if that is also not feasible for you financially, listen to your body. And I know that that can be like a really frustrating piece of advice because people are like, okay, well, I'm pregnant. My body is different. Nothing feels normal. I don't know how to listen to my body. And like, trust me, I get it. But paying attention to how the exercises feel in your body, like if it's causing pain, discomfort, like if you're doing a squat, you've been doing squats for years, but right now you're doing a squat and something just feels off. Like you're feeling something in your pelvis or your low back, like, like, okay, that's not how my body normally feels when I do this exercise. So just paying attention to things like that and knowing if you need to make some adjustments. And that could just mean like you're not squatting as deeply, or you're doing like an assisted squat where you're just like squatting down to like tap a chair, just like making adjustments, regressing, like I mentioned before, paying attention to that coning, like I mentioned, and even just adjusting your exertion. So when you're working out during pregnancy, you should be able to still carry on a conversation with someone. You should not be out of breath, gasping for air, your heart rate like skyrocketing. You should not be at like your max heart rate. So just being mindful of your exertion, not exerting yourself too much. You shouldn't be sore for like days on end either. If you are, that means maybe pull back a little bit. But yeah, take comfort in the fact that as long as you're not doing those activities we mentioned in the beginning that are like generally off limits, like the extreme sports, risk of falling, that kind of stuff, your baby is safe. And I want you to remember that your baby is protected by amniotic fluid. They're in your uterus, like they're safe in there, and there's really not much that you can do in terms of exercise that can hurt your baby.
I think that's really reassuring and also just like helpful for people to know like, okay, like these are kind of some of my options. So if you are looking to do this, I know Megan has one-on-one coaching available, so people can reach out to her. We can leave links for that in the show notes. But I think that wraps up our conversation today on pregnancy safe exercises. And we will be back next week with a new episode. If you want to reach out to either Meg or myself, Meg's at Vibrant Mama Wellness on Instagram, and I am at Wholesome Huntress Nutrition on Instagram. And we'll see you guys next time.